Good afternoon. Bonjour. As the COVID-19 pandemic continues, it becomes increasingly more important that we protect those who are protecting us. Doctors, nurses, paramedics, lab technicians, and a host of other healthcare workers, including those working in nursing homes and other healthcare facilities, are working hard every day to protect us against the spread of this virus and provide care to those who become ill because of it. They are putting themselves in harm's way for all of us, and they deserve our profound gratitude. We can repay them by making sure that they are adequately protected in their workplace. Today, there are 11 new cases of COVID-19 confirmed in New Brunswick, which brings the total number of reported cases to 81. The new cases are as follows. In Zone 1, there are 2 new cases between the ages of 20 and 59. In Zone 2, there are 3 new cases between the ages of 40 and 69. In Zone 3, which is the central area, there are 4 new cases between the ages of 30 and 59. And in Zone 5, the Campbellton area, there are 2 new cases aged between 50 and 69. And of the 81 cases reported to date, 43 have traveled outside New Brunswick in the 14 days prior to the onset of their symptoms. 22 are close contacts of confirmed cases, and 3 of the cases have no travel history or confirmed contacts, in other words, community transmission, and 13 cases remain under investigation. Je vous annonce qu'il y a 11 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick aujourd'hui, portant le nombre total de cas signalés à 81 dans la province. Répartis comme suit. Il y a 2 dans la zone 1, la région de Moncton, âgés de entre 20 et 59 ans. Il y a 3 nouveaux cas dans la zone 2, la région de Saint-Jean, âgés entre 40 et 69 ans. Il y a 4 nouveaux cas dans la zone 3, région centrale, âgés entre 30 et 59 ans. Il y a 3 nouveaux cas dans la zone 5, région de Campbellton, âgés entre 50 et 69 ans. Parmi les 81 cas confirmés jusqu'à présent, 43 personnes avaient voyagé à l'extérieur du Nouveau-Brunswick dans les 14 jours précédant l'apparition des symptômes. 22 personnes ont eu des contacts étroits avec un cas confirmé et 3 personnes n'ont aucun antécédent de voyage ou de contact avec un cas confirmé, c'est-à-dire qu'il s'agit d'une transmission communautaire, et 13 cas font toujours l'objet d'une enquête. This virus doesn't discriminate. We are all vulnerable to it. And that includes healthcare workers. So while we do not have any cases to date where transmission happened in a healthcare setting, we do have healthcare sector employees who have contracted COVID-19 outside their workplace. This is precisely the type of situation we must avoid. As I've mentioned numerous times before, healthcare workers are the ones who will be saving the lives of those who become ill with the disease. Of the 7 cases I mentioned, there are various causes of transmission. While I cannot speak to any of the specific cases, healthcare workers, like the rest of us, could acquire this illness in a variety of ways. Some have traveled, some are contacts of cases, and some have had contact with others. Les travailleurs de la santé, comme nous tous, peuvent avoir attrapé le virus de différentes façons. Certains ont voyagé, d'autres ont été en contact avec des voyageurs ou avec d'autres personnes infectées. If there is a case where a healthcare worker becomes ill, the process remains the same. If they have been in direct contact with the public, that would be made public. If the workers had no direct contact with the public, but their close contacts would be notified by public health as part of the normal investigation process. And if there was a workplace exposure, that would be something that public health would deal with as well. So we are also aware of a Fredericton case involving a taxi driver who has tested positive. That driver was in contact with a traveler they picked up at the airport. Public Health has been working with the cab company to identify anyone who had been in close contact with the driver, and I spoke with the Regional Medical Officer of Health investigating this case, and she has assured me that each of those people have been contacted and have been told to self-isolate. And so that investigation is still underway, but my understanding is each one of those people has been contacted. Le virus sévit sans discrimination. Nous y sommes tous vulnérables, y compris les travailleurs du secteur des soins de santé. Bien qu'il n'y ait aucun cas de contagion dans un milieu de soins de la santé jusqu'à présent, certains travailleurs de la santé ont contracté le COVID-19 ailleurs que dans leur milieu de travail. Ces cas sont liés à des voyages et des personnes infectées se sont auto-isolées. Elles ne retourneront pas au travail avant d'être complètement remises de leur maladie. These are people we rely on to take care of us, and we need them to be healthy. That is why we have expanded our testing protocols to test more broadly within the healthcare system. We absolutely need to prevent the spread of COVID-19 in places where care is being provided. I know healthcare workers themselves are concerned about their own health, and I share that concern. Prior to going into public health 5.5 years ago, I was a family physician. I worked as a hospitalist. I have worked with mental health and addictions, and I was a practitioner during SARS, and I was also a practitioner during H1N1. So I do understand the concerns of frontline healthcare workers for their own safety, for the safety of their patients, and for the safety of their families. And we need all of our healthcare workers to stay healthy. And not just from a personal physical health perspective, but also their mental health. I also watch social media just as you do and as the healthcare workers do, and some of the images and stories that we hear from the United States right now and also in other jurisdictions are not pleasant to watch. So I think with respect to those fears and concerns that we all share, I think it's especially important to be able to support healthcare workers and frontline workers and essential workers through this time. And by that support, I mean being compassionate, but I also mean doing your part to stay home. We can't do this alone as a healthcare system. We need the support of every single individual in this province to do their part. We are watching numbers of cases increase in other parts of the country. We are watching outbreaks in nursing homes unfold. We really need to take this very seriously. Each and every individual has a part to play. And so I am imploring all of you to continue to follow the directions around staying at home. It is really, really important. We need the public to remain confident that our healthcare environments are safe for them to visit when they have to. There are concerns today about the supply of personal protection equipment, or PPE, for healthcare workers, and I am confident that we have what we need, but we have to maintain our supplies and use them appropriately. For the general public, I urge you not to obtain or use masks made for the healthcare sector. Our healthcare workers need this equipment to protect themselves and to protect you. Des préoccupations ont été soulevées aujourd'hui concernant l'approvisionnement en équipement de protection individuelle pour les travailleurs de la santé. J'ai confiance que tous nous avons à notre disposition tout ce dont nous avons besoin, mais nous devons maintenir nos stocks et nous servir de l'équipement de façon adéquate. Je demande aux citoyens de ne pas se procurer ou de servir de masques destinés au secteur des soins de la santé. Les travailleurs de la santé ont besoin de cet équipement pour se protéger, ainsi pour vous protéger. If we all do our part, the people who are counting on to protect us will be protected. If you observe physical distancing, regular hand washing, and good hygiene, you don't need to wear a mask. There are some stories and some studies that are on social media currently. Our counterparts at the Public Health Agency of Canada have investigated some of the information that is circulating around homemade masks. And so there is information around that we can share with you around the homemade masks for individuals who want to protect themselves. There are pros and cons around that. And so I think there will be more information around that in the coming days. But as a general rule, we certainly don't want the general public wearing surgical masks or any masks that are intended for healthcare workers. So while there isn't proven evidence that wearing a homemade mask will be completely protective, there is some evidence that you can do that as long as you make sure there are no gaps in the mask. And again, I will have other information available on that shortly. While there are cases of community transmission in New Brunswick, in the current situation, public masking by the general population is not necessary. But healthcare workers do need masks to safely carry out their duties, and their needs have to come first. For those working in healthcare settings, this means that PPE must be used wisely. This week, I have joined with my colleagues with the regional health authorities, Ambulance New Brunswick, and other health agencies in advising health sector employees on the judicious use of PPE supply. We are also in contact with our partners, including WorkSafe New Brunswick and the unions which represent our workers, to keep them informed on this issue. I'm confident that we can continue to collaborate with all of our partners to meet this challenge. And it is a challenge. It's a very, very real challenge. And again, we've seen what's happened in other jurisdictions, and so taking into account the information that we have today, it's really, really important to have these conversations and face these challenges together as a province. We have enough supplies on hand to meet our current needs. Our current stockpile is at the desired inventory based on the moderate level of pandemic influenza scenario. And we are working with the federal government to obtain more as the pandemic progresses. Our first allocation from the federal government is currently en route to the New Brunswick Emergency Stockpile Warehouse. We are committed to ensuring that our frontline healthcare workers are appropriately protected so they can do their job safely. And if you want to protect those who are there to protect you, the best thing you can do is to stay home. Nous sommes résolus à bien protéger les travailleurs de la santé de première ligne afin de leur permettre de s'acquitter de leurs fonctions en toute sécurité. Si vous voulez aider à protéger les gens qui sont là pour vous protéger, la meilleure chose à faire est de rester à la maison. Staying home will save lives. Staying home will mean fewer infections, less spread of the virus, and fewer patients needing urgent medical care. And as you know, some of the cases today, not the new cases today, but in a general sense, we do have some patients that are hospitalized. And we do know that that is also something that will increase our concern and our level of anxiety around COVID-19 infections. It's not surprising that we do have some cases that are hospitalized, because we do know that a certain percentage of people will require hospitalization and a certain percentage of people will require ICU admission. And we do know that a certain proportion will not survive. So we are aware of this information, and these are all the pieces of information that we're using to inform decisions moving forward and our planning procedures. So, wash your hands regularly and thoroughly when you have to go out. Keep your interactions brief. Maintain that vital 2 meters of distance, of physical distance between yourselves and others. Don't take chances with this virus. Don't gamble with your health and the health of others. We all need to keep doing what we are doing. It will make a difference if we all work together on this. Ne prenez pas de risques avec ce virus. Ne mettez pas en péril de votre santé ni celle des autres. Nous demandons tous continuer à respecter les mesures que nous appliquons présentement. Nous pourrons contribuer à la lutte contre ce virus si nous travaillons tous ensemble. Thank you very much. Merci beaucoup.
Good afternoon. Bonjour. Since this pandemic began, we have all been asked to make sacrifices. I'm going to continue to ask a lot of you in the days ahead. We cannot do this alone. We need all of you to do your part. We need you to continue to stay at home wherever possible and keep a safe physical distance from other people at all times. We need you to help us to flatten the curve. In the coming weeks, we hope to see evidence that our strategy is working and our sacrifices have all been worth it. Vous devez continuer de rester à la maison et vous devez continuer de garder une distance physique sécuritaire entre vous et les autres personnes. Vous devez nous aider à planir le cours. Au cours des prochaines semaines, nous espérons pouvoir constater que notre stratégie fonctionne et que nos sacrifices valent la peine. Failing to obey the emergency order that is currently in place has serious consequences. The All-Party Cabinet Committee on COVID-19 and the Cabinet have agreed to extend the state of emergency declaration for another 14 days. We will reassess the situation in 2 weeks and will continue to extend it as needed. Most New Brunswickers understand that we are under a state of emergency and have been acting appropriately. But we still are seeing reports of people who are not taking the situation seriously. We need these people to understand that violating an order under the Emergency Measures Act is against the law, and peace officers can lay charges. These fines could start at $292 and can go as high as $10,200. We are willing to do what it takes to protect the safety of all New Brunswickers. Public safety officers are following up on reports we receive about businesses or individuals who are not obeying the emergency order, and they will continue to do so. We are now monitoring public areas like beaches and parks to make sure people are obeying physical distancing guidelines and are not gathering together in groups. We're putting up barriers in public places as needed to prevent people from gathering, and we are deploying security guards and law enforcement officers. It is unfortunate that this is necessary, but gatherings put us all at risk. And I ask everyone, no matter what their age, if you don't care about yourself, think about your parents or your grandparents and how you would feel if you and your friends got together and one of your friends were infected, and then you in turn infected your parents or grandparents. Nous surveillons maintenant les espaces publics, comme les places et les parcs, pour nous assurer que les gens respectent les mesures de distanciation physique et qu'ils ne se rassemblent pas en groupe. Nous installerons des barrières dans les espaces publics quand ce sera nécessaire pour éviter les rassemblements. Et nous aurons des gardiens de sécurité et des agents d'application de la loi sur la place. C'est malheureux, mais c'est devenu nécessaire parce que les rassemblements mettent tout le monde en danger. If you do see someone breaking the rules, please do not confront them yourself. It's important that we allow the authorities to do their jobs and handle these situations safely. If you observe a dangerous situation or see someone violating the rules, report the incident, but you don't need to get involved directly. If you have concerns or are looking for more information, please call our toll-free number at 1-844-462-8387. We obviously want to avoid physical altercations amongst friends and neighbors, but it never hurts to remind someone of the need to follow the public health rules. I want to acknowledge the concerns of our frontline workers, especially in regard to having access to adequate personal protective equipment. I can assure you that the government is doing everything within our power to make sure we have the supplies we need. But as Dr. Russell stated, it's important that we use our equipment and our requirements to protect individuals that need protected at the times that they are serving public, especially our healthcare workers and people that are put themselves in harm's way for the better good of all. I was pleased to hear the Prime Minister's announcement yesterday that the federal government will invest $2 billion to produce necessary supplies, including ventilators, testing kits, and personal protective equipment, such as masks, face shields, gowns, and hand sanitizers. We will continue to work closely with the federal government and the other provinces to ensure we have access to these supplies in New Brunswick as the demand increases. And we have been assured by the federal government that we will have the necessary supplies available to us, but it's important for us to use them as necessary. I want to thank all of the essential workers who are continuing to show up to work and keep the rest of us safe. Your dedication is beyond measure and much appreciated by all. I'm grateful to the doctors, nurses, paramedics, and all of the healthcare workers who play such an important role in protecting New Brunswickers every day, especially during this current crisis. I would also like to thank all of the workers in our nursing homes, special care homes, and community residents, as well as providing home support and attendant care to our seniors and adults with disabilities. We have so many people to be thankful for. The work you are doing to protect some of our most vulnerable residents is much appreciated. We thank you for all that you do now and all that you've been asked to do in the coming weeks as we all tackle this emergency together. Je remercie toutes les personnes qui travaillent dans nos foyers de soins, dans nos foyers de soins spéciaux et dans les résidences communautaires. Je remercie aussi toutes les personnes qui fournissent du soutien et des soins à domicile aux jeunes et aux adultes qui ont un handicap. Le travail que vous faites pour protéger certains de nos résidents les plus vulnérables est apprécié. Nous vous remercions pour tout ce que vous faites maintenant et pour tout ce que vous allez dans les prochaines semaines, alors que nous faisons face à cette situation d'urgence ensemble. We know the number of COVID-19 cases will rise in New Brunswick over the days and weeks ahead. We're doing everything possible to prepare our system for this increased strain. We're encouraged by the 14 recoveries that we've seen, and we just hope to see more of those in the coming days and weeks. But we know our overall numbers will rise, and we must be prepared. Some of the things that are being done within the health system that have been a combination of people working hard to make changes and people respecting the need to utilize our services in healthcare when absolutely needed. Since the option to book virtual doctor appointments was introduced on March 13th, 60 to 70% of office visits have been converted to virtual appointments. Right now, there are 50% fewer visits than usual to emergency departments in our province. This is a needed break at this point in time when emergency rooms are used only for emergencies, and that our healthcare professionals can have the opportunity to plan for future needs as they arise. Compared with March of 2019, ambulance calls were down about 900 in the month of March this year, a reduction of almost 10%. We have also freed up over 800 hospital beds to provide urgent care as needed. And why are all these stats important? They're important to show just what actions we can take to meet the demands, not only of today, but what future demands may come. I am confident that we can continue to innovate and implement new strategies to ensure our healthcare system will meet the challenges ahead. I appreciate that New Brunswickers are using these services only during real emergencies, and that's what the importance of all of us playing a role in dealing with this crisis. We will continue to work closely with health authorities to make sure we are doing everything possible to reduce capacity and prepare the system for what is coming. Please continue to do your part. We have the power to save lives. Stay at home. Nous devrons tous être proactifs pour réduire la propagation de cette maladie le plus possible. Nous vous demandons de continuer à faire des efforts pour y arriver. Vous avez le pouvoir de sauver des vies. Restez à la maison. Thank you. Merci.
Thank you, Dr. Russell and Premier Higgs. We'll now proceed with questions from the media. Nous allons maintenant procéder aux questions des journalistes. Each reporter will have one question and one follow-up, and you are invited to ask your question in the official language of your choice. Chaque journaliste aura une question et un suivi, et vous êtes invité à poser vos questions dans la langue officielle de votre choix. First up, Silas Brown, Global News.
Hi there. This is for the Premier. Obviously, rent for businesses and for individuals is due today. I'm wondering what you have to say to New Brunswickers who are struggling to make those payments today.
Well, certainly we've provided some adequate funding that is coming forward, and that started, I think at this point in time, we've had about 40,000 applicants for the $900 at the kind of the break between the time the EI came into place federally. The landlords, we've actually put out a request that they defer rental as required. We're asking people to pay it if they can. If they can't, we're expecting landlords to help them through this rough patch. We said we want everyone to have security of home. We want everyone to have security of finances and security of supply. And I expect that means that people who are in a position to help others do just that. And so we've asked landlords, and we've actually put in place there will be no evictions during this time, and I think we use May 31st. But the idea is that we expect everyone to consider individuals' situation and react accordingly to ensure that they're protected.
Did you have a follow-up, Silas?
Yeah, when we look at the time it's going to take for the federal money to start rolling out, I know yesterday you said that the number of applications for the New Brunswick emergency benefit was 38,000. I'm wondering what we're up to for that today, and if you would consider adding more money from the province to help people bridge this gap until we start to see this federal money roll out?
The current number is around 45,000. And yes, yes, indeed, I will consider adding more money as required. I said that in this crisis, our focus is safety and the welfare of citizens of this province, and that will be our singular focus. And we will put whatever resources necessary to ensure we meet that goal. We are accumulating this total. We're treating this like other disasters that we've seen, natural disasters. But and that's why we took the time to figure out the gap between the federal plan and the plan that we thought that was needed. So we will continue to monitor that gap, and we'll continue to fix the gap as necessary.
Mathieu Roy-Como, l'Acadie Nouvelle.
Bonjour, Dr. Russell. Pouvez-vous nous dire si dans les cas qui sont rapportés depuis le début de la pandémie, s'il y a eu des cas dans les foyers de soins et quelles sont les quelques mesures là, qui sont prises pour améliorer la sécurité des patients, pas des patients, mais des résidents dans les foyers de soins?
Bonjour. Jusqu'à date, on n'a pas eu des cas dans les institutions des foyers de soins jusqu'à date. Les mesures qu'on a déjà prises, ça inclut les directives sur comment les visiteurs peuvent être accueillis ou non. Alors, je crois qu'il y a des restrictions sur les visiteurs. Et aujourd'hui, on va commencer à implémenter une directive pour les travailleurs de santé dans les foyers de soins. Et ça veut dire qu'ils vont commencer à prendre leur température avant qu'ils peuvent rentrer dans l'établissement pour travailler. Alors, ça, c'est quelque chose pour une directive pour augmenter la protection des patients dans les foyers de soins, parce qu'on sait que ça, c'est vraiment un endroit très vulnérable. On voit des situations dans d'autres provinces, d'autres provinces au Canada, le Colombie-Britannique, le Québec, Ontario. Il y a des situations où il y avait des éclosions dans des foyers de soins, puis c'était vraiment tellement terrible. On ne veut pas voir ça arriver ici au Brunswick. Alors, on veut prévenir ça et préventer ça.
Est-ce que tu as un suivi, Mathieu?
Oui, s'il vous plaît, toujours pour Dr. Russell. Pouvez-vous nous répéter le nombre de personnes qui sont remis et qu'est-ce qu'on fait pour déterminer qu'une personne s'est remis de la COVID-19? Est-ce que c'est simplement parce que ça fait 14 jours qu'ils n'ont plus de symptômes ou est-ce qu'on refait des tests? Comment ça fonctionne pour déterminer que quelqu'un s'est remis de la COVID-19?
Vous voulez savoir le nombre? C'est 14 qui sont récupérés et il y a différentes circonstances. Au commencement, il fallait avoir 2 tests négatifs de suite, mais si c'est des cas où il n'y avait pas de symptômes sévères, où il y avait les symptômes étaient passés, ils ont complété leurs 14 jours, ça peut être une combinaison de ça, mais je sais dans certains cas, c'était des tests négatifs 2 à la suite. Et certains cas que c'était parce qu'il n'y avait plus de symptômes, puis il y avait passé 14 jours après le commencement de leurs symptômes.
Andrew Waugh, Telegraph Journal.
Thank you. So, Dr. Russell, we understand that the case involving the cab driver was made public on a Reddit thread. Why wasn't any information given out about this in the public? And is this the way New Brunswickers can expect to find out about cases where people have been in public?
Hi, Andrew. So I understand these concerns because there are other situations where the public did find out about cases in a way that wasn't transmitted through our office or through my daily reports or through a press release. The situation will continue to evolve in terms of how things progress with cases and transmission in the future days, but our approach won't change with respect to how we contact each individual case. We contact each individual close contact of those cases. If there is a workplace exposure, we deal with that. If there is an institutional exposure, we deal with that. through our public health regional offices, and every time there's a public exposure, I will be announcing it publicly. So that I can guarantee. So in this particular case, public health was successful in getting contact information for each individual person that was considered a close contact. So I understand your fears and concerns. I understand that that would also be shared by the public. Will I be notified if I'm exposed? And my answer is yes, and it will continue to be yes. You will be contacted either by public health individuals because you were a close contact, or because there was a workplace exposure or an institutional exposure. And when there is a public exposure, I will be telling you publicly that that has happened.
And did you have a follow-up, Andrew?
I do, and this one is either to Dr. Russell or to the Premier. There's a lot of talk in your opening remarks from both of you about medical supplies and personal protective equipment. You seem to be both reassuring the public that there's enough, but also warning the public not to obtain any masks. Can you talk to us about what's going on there? I mean, I feel like I'm kind of getting two different and potentially conflicting messages.
Well, I think, and so in looking at our quantities that are available to us, and in our discussion with the federal government, we have been assured that we'll have the adequate supplies we need. And certainly as we do the testing, we want to make sure we're doing the testing in the most pertinent areas so that we can use our supplies in the most prudent way. And that includes, you know, in any category, but making sure like health workers are protected and that we have the right program in place. The concern of some of it is people, and just this past day, there was, you know, the health authorities all agreed on what type of protective gear should be worn going forward. So that was kind of a major kind of step forward, because now we don't have disagreements about what people should wear. It's this is what's being suggested by the World Health Organization and others, and now it's adopted here in New Brunswick. The idea of just saying, look, let's manage the resources we have, is that in some cases, you know, it's like the toilet paper syndrome, where everybody thinks they need a garage full of toilet paper. Well, you don't need a garage full of masks. And so the idea is, let's ensure that we use the equipment where it is needed, and let's ensure that people doing the job that's required is absolutely, they have the right equipment for that job. If we don't do that, then we run the risk of not having the right equipment for the people that need it the most. And that's why the caution. There's a caution part of this, and there's a confidence part of this. We can manage this system. We can manage this healthcare crisis, but we have to ensure that every aspect of it is looked at prudently.
Vicky Hogarth, Charlotte County TV.
Thanks, Steve. My question is for Dr. Russell. Dr. Russell, of the New Brunswickers who have called 811 to report symptoms, what percentage of them are being tested, and what might make a person who calls 811 with symptoms not get tested?
So I don't have the stats on how many people called and how many people got tested. I probably have some data on that I can try to look for you if I can find it. So I will look for that for you. How about that? The second part of your question would be around what is the criteria if you do call 811 to allow you to get tested, and there's a couple of answers for that, and it will continue to change as the case definition changes. So as of right now, it's the travel component of the questions that you're asked when you call 811 are still part of that. The healthcare workers and essential workers won't be required to have that component. But moving forward, we're looking at changing that as well to allow people who haven't traveled but have symptoms that meet the criteria of getting tested would be tested. Again, managing resources is really important. So in other jurisdictions, they are just considering close contacts of people who have been diagnosed with COVID to be considered cases and followed up as such. I think in this province, we probably want to continue to track people and have that confirmation in a lab test moving forward. So we are working with 811 on moving forward with different messaging around that. But certainly for healthcare providers right now, the fact that there are opportunities for people to access healthcare through virtual care with their family doctors if you have that opportunity and you tap into that resource, then you can have a conversation with your physician about whether or not they have a strong feeling around having you tested in using their judgment. So that is happening and has happened throughout since we started testing people in mid-February.
And did you have a follow-up, Vicki?
Yes, this is also for Dr. Russell. There are concerns among New Brunswickers that tests are being rationed in the province. Can you just give us an idea of how many test kits we have, how many we plan to acquire, just to put people's minds at ease, and can you speak to that concern of test rationing?
So I wouldn't necessarily call it rationing, we would call it prioritizing. And so I've emphasized, you know, as the case definition has evolved, it changes the risk of who in the population we would be looking for in terms of finding cases of COVID-19. And this is something that is really shared across the country in terms of a national approach. And so the national approach keeps in mind our supplies and utilizing those resources appropriately and effectively. So, so as the case definition has evolved from travel outside of Canada to travel outside of New Brunswick, to now including healthcare workers in closed institutional settings where the risk is so much higher to those people who are most vulnerable. That is why we are really looking at testing people in the hospital system right now, as well as healthcare workers, because again, the risk of transmission to those facilities and within that population, those vulnerable populations, is really, really key. We also know that as of right now, I think over in the last day, we've done 500 tests compared to yesterday, and we know that we do have capacity at this point in time. I think how long our resources last really depends on the number of tests per day, but we certainly have the capacity to do, you know, up to 700 to 1,000 tests a day if we need to. And again, keeping in mind that we don't have an inexhaustible resource in terms of the testing units themselves. So again, that's why we have to make decisions around prioritizing. But at this point in time, as I said, we will be continuing to follow people and test people who call 811 who meet the criteria, and we are in communication with 811 around changing that moving forward. Again, keeping in mind that for throughout all of these scenarios and all of these cases, it is really important for everybody who can stay home to stay home.
Elizabeth Fraser, CBC.
Hello, my question is for Dr. Russell, and I say this respectfully, but information about flights that carried COVID-19 positive passengers seem to be more likely to come from the airport than you yourself. So in light of the community spread now taking place, what message are you really sending that someone who might have been in the airport when a particular flight landed but isn't an airline or airport employee doesn't have to worry, because otherwise wouldn't you identify the flight?
My understanding is that the flight information is being provided to the public by the airlines, and my understanding is there is access to information on the Public Health Agency of Canada website around flights. So, and in any of the investigations that our public health officials have been involved in the regions, again, the contact tracing would be done in each individual case, as I have described earlier.
Do you have a follow-up?
Okay. Yes, I do. And again, I say this respectfully, but I've noticed that during the news conferences, both of you are sharing a microphone, and other provinces, while they're holding their news conferences, they're using separate microphones. And actually, during this news conference, we saw Blaine Higgs actually touching the microphone. Shouldn't you be setting an example for the rest of us? Why are you still sharing this microphone during the news conference?
That's a good point. And coming back to your other points around air travel, anybody coming from outside the country who has symptoms when they land, would be in quarantine because of the new border measures that are in place. Anybody coming into the province needs to self-isolate for 14 days. So in terms of risks around travel, everybody who's coming into the province needs to self-isolate for 14 days. And I take your point around the microphone, and we can definitely address that. We do have some Purell here that both the Premier and I are using. So we are disinfecting our hands when we come up to the podium and leave again. But certainly, and we are trying to do our social distancing, but certainly I'll take your point around the microphone.
Okay, just other provinces have their own separate podiums too. I wonder if that's something you're considering doing, just to set an example.
We'll definitely look at that.
Kevin Bissett, Canadian Press.
Dr. Russell, some prisoners in the region are expressing concerns today that there isn't sufficient social distancing in prisons and provincial jails, and they're worried about spread of COVID-19. Have you looked at those facilities, and have there been any positive cases in New Brunswick correctional facilities to this point?
My understanding is there have not been any positive cases in correctional facilities in the province at this point, and I do understand there are concerns around social distancing, and so I take your point. It's very valid.
And did you have a follow-up, Kevin?
Yeah, I'm wondering, is testing being done at these jails and prisons, and what measures are being taken to make sure that there is some social distancing there?
I can definitely look into that. I'm not aware at this point in time of what is happening, but obviously if there was somebody in an institutional setting that did need to be tested, they are prioritized.
Laura Brown, CTV.
Hi, Dr. Russell. I'm wondering if you can tell us, you mentioned hospitalizations at this point. Can you tell us how many are in hospital today and if any are in the ICU?
I have the number of hospitalizations right now is there are 4 people in hospital, but they are not in ICU.
Did you have a follow-up, Laura?
Yeah, the Premier, please. I'm wondering, I spoke to the owner of the cab company in Fredericton here this morning, and he expressed a lot of concern about, fear-mongering, specifically on social media, and that it kind of hurts his business, what's left of it at this point. Wondering if you have a message for people on social media specifically, and for those businesses that are trying to stay open.
Well, I guess, there's been some very extensive programs put in place for businesses that have seen, in the federal case, it's a 30% decline in the case, and it applies to all businesses, and so they're eligible for funding in that regard. I don't think people can be too careful, and I know that individual businesses are impacted, and I have sympathy. Certainly, I understand in the taxi business, but it's one of those particular areas where a lot of transmission could take place, moving different people around, and unless there's some way to clean the vehicle down after every move, and have this distance apart from each passenger, it is a risk, and so I think that it's part of weathering this storm, and I'm hopeful that the compensation packages that are available are certainly available to this company that you're speaking of and others, and they need to take advantage of that, because we all have to do whatever's necessary to keep safety within the public.
Michel Corriveau, Radio-Canada.
Bonjour, c'est une question pour Dr. Russell. Dr. Russell, j'aimerais savoir, aux États-Unis, la CDC rapporte qu'il y aurait presque 25% des gens infectés qui ne présenteraient pas de symptômes. Alors, ça pose tout un problème quand vient le temps de tester. Comment vous abordez cette question-là ici?
Vous avez reçu un rapport que 25% n'ont pas de symptômes?
Jusqu'à 25% des gens n'auraient pas de symptômes.
Ça, c'est pas l'information que moi j'ai reçue, et à l'avis de l'Agence de santé publique du Canada, c'est valide qu'il y a des gens qui sont n'ont pas des symptômes, qui ont le COVID-19. Ça, c'est vrai, ça peut arriver. Et c'est quelque chose que le World Health Organization supporte aussi. Mais c'est pas la transmission de quelqu'un comme ça, c'est pas vraiment fort. Alors, c'est pas quelque chose que nous donne des craintes ou des inquiétudes à ce moment-ci au niveau du pandémie. On sait que ça existe, mais c'est pas la chose qui cause la majorité de la transmission. Et aussi, on sait que même les gens qui ont des symptômes de COVID, environ 2 jours avant, c'est un temps qu'ils pourraient avoir. J'ai dit ça l'autre jour dans quand on avait eu notre conférence technique l'autre jour sur tous les détails. C'est quelque chose que oui, on sait que les gens qui ont des symptômes 2 jours avant, ça se peut qu'ils ont encore le virus, il pourrait tester positif, mais aussi, c'est pas le temps qu'on croit que la majorité de la transmission va arriver. Ça va vraiment arriver après qu'ils développent des symptômes. Mais on avait changé nos directives et nos protocoles pour inclure quand on contacte les gens qui ont le proche contact avec des cas maintenant, ça commence les 2 jours avant pour les contacter puis leur dire qu'ils devraient être isolés.
Est-ce que tu as un suivi, Michel?
Oui, bien sûr, c'est pour le premier ministre, M. Higgs. J'aimerais savoir, M. Higgs, on a vu rapporter dans des médias qu'il y aurait eu des changements aux frontières au niveau des règles pour les gens qui peuvent entrer au niveau Brunswick. Donc, est-ce que vous pouvez confirmer qu'il y a eu des changements? Et si oui, quels seraient les changements? Quels sont les changements aux frontières provinciales, interprovinciales?
So, Michelle, we're looking at, there haven't been any changes that are, let's say, dramatically changed at this stage, but we are looking at the consistency of border crossers. In other words, people that are coming into the province and working regularly, because there's been some concerns about, in that case of Quebec, workers coming into New Brunswick and working and then having difficulty getting back home. So we are working with Quebec officials on that, because in that case it's a mutual benefit for both. There are cases where we have regular people coming that are coming, for work purposes again, and we're starting to get the routine. So I don't think there's anything dramatic. The only thing I'm aware of is that particular issue around workers coming in, working in New Brunswick, and then heading back home and having trouble to get back into Quebec. And we're working with officials on that.
Danielle McCready, CBC.
Hi there. My question is for the Premier. We asked yesterday if you would be directing municipalities to close their parks, and you said that you would expect them to, but there seems to be some lingering confusion about whether they actually have to close, how you would enforce that, or, if they should close, since a lot of people in these parks seem to be respecting physical distancing. I guess, what can you tell us around, municipal parks and potentially seeing them shut down to the public?
Well, I believe that the municipalities are enforcing the rules in the social distancing requirement, and that's what's important. If they, we're speaking to different municipalities about enforcement, and if they are able to maintain that capability throughout their system, throughout their community, then I would say we'd be comfortable to allow them to enforce their own rules around their own property. But the idea is that we maintain the rules of distancing, and that won't be optional. And but I am not familiar with any particular, let's say, municipal facilities that aren't being monitored or that we've had complaints that aren't being dealt with.
And did you have a follow-up, Danielle?
Yeah, also for the Premier. What is the province doing, or maybe told the police to do, for people who are falsely claiming to have the virus? We've heard about that happening here.
So I'm not familiar with that being a situation, but I mean, that's a pretty sad commentary on society, I guess, if someone is claiming that, and what would be the purpose? To be tested, in which case we'd be looking for symptoms. We haven't heard a report back. I haven't heard a report back on that. But I think it would be it'd be unfortunate that someone thinks this is a joke. This is no joke. This is no time for false accusations or false, let's say, concerns that people are making. It's difficult enough for us to work with everyone and to keep people safe, and we expect people to actually follow the rules, but we certainly expect them to be credible and honorable in dealing with each other. And I'm sad to hear that's the situation. I will follow up with public safety to confirm.
Is that something you can charge someone for or arrest them or anything?
Well, public mischief, I guess, and I don't know how deep. I'm not a police officer, but I would assume that if it's creating, let's say, anxiety within society, that there would be a mechanism there to deal with that. But to what extent the situation exists, it has not been brought to my attention.
All right. Thank you so much.